1440 KVON 99.3 The Vine. This is Kelly, and it is time to talk about a really amazing place. It's an exceptional place. We're going to find out why in a moment, but it's the new St. Helena Women's Center. And with me this morning, the administrative manager, Corey Swindlehurst, and a special guest. We actually have a doctor here this morning. We're going to get to her in just a moment, but good morning, Corey.
Good morning.
It's great to have you here.
Thanks for having me.
This is really exciting. I was looking over the list of services you offer. Tell us a little bit about the St. Helena Women's Center and what makes it an exceptional place.
Sure, I'd love to. Our new St. Helena Women's Center is an amazing place, you're right. It's a place that allows women a tranquil setting to come and receive medical specialties throughout any phase of our lives.
Oh, that's really nice. What do you mean by tranquil? Is it the colors? Is there a little bit of music piped in there?
It's all there. We have fresh flowers. We have music. Yes, you're right. The colors are nice, calm, and engaging.
Oh, that's nice. I really like that. So let's talk a little bit about these services that are offered at the St. Helena Women's Center. So first of all, not surprising, you have some OBGYNs. Let's talk about them.
Yes, we have Dr. Brian Henry, who's been with us for quite a while. And moving to our new center has been a wonderful experience for all of us. He specializes in obstetrics, you're right, and also pelvic reconstructive surgery.
Oh, and he's able to do that at the hospital there in St. Helena?
He does both, yes. We do a lot of procedures or treatment in our clinic in St. Helena Women's Center, but then also he does do surgeries that need to be performed at St. Helena Hospital.
Okay, so you also have some office, and maybe he can be on the show sometime in the future to talk about that.
I'm sure he would really enjoy that.
And then you have Dr. Michael Bagish as well.
We do. He is an amazing provider as well. He's a gynecologist who is known globally for his expertise. Wow. He's actually written the book. A lot of other providers, have actually read his book, and he's an amazing
he's
person.
Literally written a book.
He has. He has.
I thought you were saying figuratively.
No, he's written several books, actually.
Oh my gosh, that's amazing.
And he's an expertise in pelvic and pelvic disorders, really.
Mm-hmm. And then very near and dear to my heart, you have a nurse midwife.
We do.
Who's wonderful.
Yes, Sue Turner. She's an amazing person. She's easy to talk to, and most of us as new patients get the opportunity to meet her at some point.
Now, is she just for women who are expecting a baby, or does she provide any well woman care?
She does well women visits as well.
Great. And that's always nice to have a midwife's perspective and input.
Absolutely.
Okay, and who else is there?
We also have Sharon Phillips, who's a certified menopause clinician, who's amazing to have on staff with us.
Now, I didn't even know you could be certified in that.
Yes,
I mean, that's really interesting.
Yeah, she's really taken time to develop her skills and provide a great service for us women.
Nice. And then you do mammograms?
We do. This fall, we actually will have our mammography department joining us, and we'll also be able to offer bone density screening as well.
Oh, wow. Now, is that like an x-ray, or what is that?
It's a bit like an x-ray, yes.
You can tell I haven't done that.
It's easy to do. It's easy to do.
Okay, good. And I was surprised to see you also have some clinicians. Well, you see you have an esthetician, a medical esthetician.
We
do.
So
break that down for me a little bit. What's a medical esthetician?
She actually can provide natural and also some chemical, if you will, ways of helping us create new skin.
Ooh, and that's Cheryl Atkins.
Yes.
So a wide variety of techniques. And is this just for your face, or?
Actually, she does have some great product lines that are just for face, but she can do massage as well.
Really?
Yes.
Boom. I can't wait. I'm making my appointment today. And you have a plastic surgeon.
We do, Dr. Herber. He's also been with us in St. Helena for quite a while, and we're lucky to have him at the Women's Center with us.
Now, what kind of surgery does that entail? Anything, or facial? Or?
Yes. No, he's a great hand surgeon, but he also does all kinds of augmentation.
Okay. and women's heart health. This is something I really hope we do a segment on in the future because it's different than men's heart health. Talk about that.
Correct. Peg Thomas is, again, an amazing physician that we're lucky to have with us. She has wonderful programs that she's outlined that we're implementing at the Women's Center. A lot of it is risk factors, and she's got some great risk factors that she can go over with you to see if you're a candidate and try and do some preventative for you.
Oh, that's great. And then we come to our special guest this morning.
Yes.
Would you like to introduce her?
I would love to. Dr. Mindy Marquez. She's a urologist, and she specializes in women's urinary incontinence.
Good morning.
Good morning.
Dr. Marquez. Well, the first thing that struck me when I was reading about the information on the St. Helena Women's Center was that you're the only female urologist within 100 miles. Are you a pretty rare breed? I mean, are there not a lot of women in the field?
Yes, there's not a lot of women that go into urology as a specialty.
And so what led you into that direction?
You know, I really like taking a condition and being able to diagnose it, treat it with medications, treat it with surgery, and really have a wide range of options for dealing with a specific problem.
And so we were speaking before the show about urinary incontinence, and I was really surprised to hear that it seemed like a large number of women do suffer from that, men as well, but mostly women, right?
Yes, it's mostly women that suffer from incontinence, but men do as well. It's about 1 in 3 women of all age groups, and about 1 in 2 women over the age of 65. And so people commonly think, oh, that just happens when you get old. But I treat teenagers, I treat young women that have had children. I mean, it can occur at any age, but is more common the older you get.
And we're going to talk a little bit about that. We should also say that it's not just for women, though, because you treat men as well.
Correct.
Right? Okay, so talk about the couple different types of incontinence.
So the 2 main types of incontinence, one is called urge incontinence, where someone has to go to the bathroom frequently, has sudden urges, and maybe loses bladder control before they can make it to the bathroom. And that typically is caused by the bladder muscle being overactive. The other type is something called stress incontinence, where the sphincter muscle doesn't close properly, and you may lose urine if you cough or sneeze or jump. And the reason it's important is because the 2 types are treated differently.
Ah, I see.
Meaning a treatment for the sphincter, may not be as effective if the problem is that the bladder muscle is overactive.
Right.
So it really takes a careful assessment of someone to try to figure out which group of treatments is going to be best for that individual.
And, you know, this is something that women complain about sometimes when they're pregnant, but that doesn't necessarily mean it's going to be a lifelong problem for them.
Correct. And actually, there are studies that suggest that if you go back to your pre-pregnancy weight by about 6 months after delivery, it can reduce your overall risk of incontinence.
Oh, interesting.
But there are plenty of women that develop this that have never had children. And so there are certain types that are more common after having children, but it's not the only risk factor.
And, you know, the fact that you are a woman, I think a lot of women might be really comfortable or more comfortable with a female practitioner in that area. So that's nice that you're at the Women's Center in St. Helena. You also mentioned that there were some different treatments available that maybe aren't so widely available.
Correct.
Talk about those.
Things that people are not as aware of. I mean, most people are familiar with medication and some of the surgical procedures, but we also offer injections for both types of incontinence, as well as stimulation of the nerves. And often it's the nerves that are telling the bladder muscle to be overactive, and we can change the way that your body interprets those messages by stimulating the nerves.
Well, that's great. It sounds wonderful. So, Corey, why don't you tell us how we can contact the center?
Sure, I'd love to. You can reach any of our providers, as Dr. Marquez was saying, by calling 707-967-7550, or you can reach us online, and that's sthelenahospitals.org.
So that's a plural, sthelenahospitals.org. I want to put that S in there to be sure you get to the website. And that number again is 707-967-7550. So what if somebody just wants to come up to see the St. Helena Women's Center and take a look? Is that okay?
Absolutely. We'd love to have you come up. We're actually planning an open house, so watch for the flyers in the mail.
Okay, well, let us know so we can tell our listeners.
That sounds great. Thank you.
Thank you both so much.
Thank you.